Chelation therapy is the practice of checking for heavy metals. Heavy metals, for example, could be arsenic, mercury, lead, to name a few, and removing them if the results show they're at high levels. So we do this by giving a chelation therapy. Chelation, by definition, are elements that bind to heavy metals in our tissues, and we remove them through our kidneys and in our urine. We also remove them through our bowels on a normal basis. When we check these levels during a chelation, what's called a challenge test or a provocative test, we actually give the patient a kit to go home with to collect their urine for 6 hours and send it directly to the lab. And the results can show us if they are elevated in some of these toxic heavy metals. So typically for chelation therapy, we check the results, and if there are high levels of lead, mercury, arsenic, cadmium, yes, they will qualify for a treatment program of chelation therapy, which involves IV infusions. We use different types of chelation agents depending on what metal is elevated. So we use EDTA, DMPS, DMSA, and glutathione. And we use them in different combinations depending on what metal is toxic to that patient. So the typical patient that comes in to get tested for chelation therapy has some chronic complaints that have not been answered. Typical complaints could be headaches, general fatigue, just a fogginess in their thought process, paresthesias or numbness, insomnia. They could have very nondescript symptoms that have been there for a long time, perhaps worked up by other doctors, and there's really no answer. So chelation offers them a possibility of finding a reason for their symptoms. And that's why we would do the chelation challenge test and check their urine to see if they have elevated levels of some of these heavy metals. Patients that suffer from heavy metal toxicity normally do not know why their levels are high or where their source is coming from. But typically it comes in our food source. It could be our diet. Maybe we're eating sushi every night. Maybe our water source is high in lead. The other thing that happens is, our internal metabolism and ability to get rid of these toxins are better or more efficient in some people than others. So all these together can lead to an accumulation of heavy metals, and they will need help to get them removed from their body.